This is Dr. Chanchal Goswami, Head of the Department Oncology Division at AMRI Group of Hospitals. This is primarily regarding the new COVID second wave of pandemic we are facing at this point of time. And from the department which I come, which is oncology, I would like to allay your fears for the cancer patients that we are fully geared at AMRI Group of Hospitals to tackle cancer amidst this COVID pandemic. I understand COVID pandemic has caused havoc at the first phase. We have overcome it and now we are facing the second pandemic. The vaccination schedule is going on, but at the same time there is a new surge of infection. We at AMRI have an entirely different building which treats COVID patient, and the normal building, which is the non-COVID building, treats with other modalities. So patients who are suffering from other than COVID need not fear to come to the hospital. We at AMRI Hospitals are treating them at a separate building, separate facility, and with separate staffs. So we have full protection, keeping social distancing, keeping hand sanitization, and keeping masks mandatory in mind. So at this point of time, we are giving all supportive care, including telemedicine, home medicine, and in-house treatment with OPD and telemedicine consultancy for all cancer patients. All the facilities of cancer patients are going on. Cancer patient management is going on amidst this COVID pandemic and at a different enclosure altogether, so that you don't need to have fear of contacting COVID while coming to the hospital. We are routinely doing RT-PCR for all admissions, and only negative patients are taken into treatment considerations. And those who are positive, since we have a full-fledged COVID department, we can send them there for treatment as well. So you need not get afraid of COVID. I understand we will have to learn to live with COVID, but definitely I will advise all of you to maintain the three most important aspects of avoiding COVID, which is using mask as a mandatory effort, do hand sanitization, and keep physical distancing. And at the same time, if you have cancer or if you are a follow-up patient of cancer, do not be afraid, do not shy away and sit at home and give the disease a go ahead. So instead of that, you feel free, come to the hospital, we are there, because if you try to stay away at home, you have got a potential of increasing your cancer. So please come forward. We have all the potential services available at our disposal, and it is for you. The hospital has made the facilities separate from the COVID part of the building. So I hope everybody who has cancer or who are facing challenges to deal with cancer should feel free and come to our hospital. We are at your service. Thank you very much.